Hi, I'm Michael Palmer with 45 Urgent Care with your tip of the week. Today I'm going to be talking to you about rotator cuff injuries. Rotator cuff injuries are a condition that affects many Americans, and this is usually an overuse injury or sports injury that will manifest itself by patients having pain in the upper shoulder. Now, what usually we see on these patients will usually have extreme pain with lifting their shoulder or being able to abduct their shoulder to the side. Now, usually when you see your provider, there's a multitude of tests that we will run to try to determine the extent of the injury. If your provider sees that the rotator cuff still has fairly good strength and we're not seeing any extreme signs of weakness, we will proceed with anti-inflammatory medications and also therapy to help reduce the inflammation and strengthening exercises to start strengthening the rotator cuff to get you back into form. Now, if your provider sees that more extensive weakness is seen, at that point he'll proceed usually with x-rays, and then to really determine if there's been any tear to the rotator cuff, we'll proceed with an MRI to evaluate the shoulder. Now, there's all different degrees of injuries to the rotator cuff. The muscle that is most normally affected is the muscle rotator cuff that is more at the posterior aspect of the shoulder. This is the one that we see mostly in athletes, pitchers, quarterbacks, from really a lot of repetitive strain of the shoulder being in an abduction position and putting a lot of stress to the rotator cuff. If your provider sees that at that point that you're having a lot of weakness and proceeds with an MRI to the shoulder and sees that there is a tear to the rotator cuff, he or she will refer you to an orthopedic surgeon for evaluation. If we're seeing that we're just dealing either with just a sprain strain and it's not responding to anti-inflammatory medications and rehab, we will at that point proceed with a steroid injection to the rotator cuff, which has been very helpful at helping alleviate a lot of the symptoms of inflammation in the rotator cuff. Now, it's very important with any of these injuries to be evaluated by your provider, who is a specialist, to be able to identify whether your shoulder is just a little bit more of a sprain strain to it comparative to it being weakness that would need more extensive testing. I'm Michael Palmer with 45 Urgent Care with your tip of the week.